Do we have another question back there?
Yeah, my name is Lawrence D'Souza. I'm from Lubbock here. And I noted that the CDC put out a report that each year 19 million new cases of STDs are detected. 19 million new cases of STDs, and half of them are for teenagers or 20-year-olds. Will the my question is, will the healthcare encourage the behavior, or will the healthcare plan be proactive to prevent this next generation from losing itself?
Does anyone on the panel have an answer for that? Do we know what the health plan says about that?
The health care plan will pay for it. The health care plan will pay for it. And this, universally, with all of us up here, we're discussing the impact of lifestyle on our health care dollar. That's a perfect example. The chicken fried steak is a perfect example. The obesity in our kids is a perfect example. We have tremendous cost in this country for things that are preventable. So we as a community have got to drill down and deal with that on our own. But I can tell you, because of requirements and state mandates and federal mandates on how insurance plans are structured, that those charges are paid. The treatment is covered.
The point that also needs to be underscored here. Tomorrow, let's wave the wand. Every man, woman, and child in this country is fully covered. Tomorrow. What changes? What changes about how our costs are going to go this way? Because personal behavior doesn't change at all. The people that have the best free health care in our country, the Indian Health Service, have the highest rates of alcohol abuse, obesity, hypertension. Diabetes. And then someone pointed out to me on a blog, and this is a fair criticism, well, those poor people don't have access to their free care because of living out in a rural zone. But that doesn't count for Santa Fe. Hop in the back of the pickup. Everybody's going. The free clinic is right there. Their behavior model is the problem. It's not insurance coverage tomorrow that all of a sudden solves our problems. You and I have to act differently. Those kids who get in these STDs need to be smacked. Now, that's trite, but hey, they're the ones who are getting urethral strictures. They're the ones becoming sterile. It isn't funny anymore. They're the ones that lose a kidney. That's real, but nobody thinks about that. No, they think, oh, let's just go into the health clinic, give them some penicillin, and be done with it. It is not that simple, and you got to know it. It's really important. Personal behavior is the start and stop of this, and that becomes responsibility financially, responsibility personally, responsibility medically. Make a right decision. And by the way, that means know when to not spend money on a medical condition and spend it on the environment, on something else that may just absolutely at that point in time be more important to you. That's being responsible too. That's my take on it.
Thank you. The next question, please.
My name is Joe. After watching with considerable interest the activity of such meetings as this over the past month of August, a thinking person would have to begin to question whether or not health care for those of us here is the real underlying problem. And you watch what happens in Washington as they see the results
Thank you. Next question, please.
Tom Key, Lubbock, Texas.
I'm sorry, Dr. May, I apologize.
You're right on target, sir. House Bill 3200 has nothing to do with providing health care for us or anybody else. It's simply a move to gain massive power, more power for the federal government. And as you said, once our lives are under control of the federal government controls us and everything else. Every single election after the federal government has taken over health care will be concentrated on health care, just as the elections in Canada and Britain are.
Correct.
Everything else, national defense, security, other issues, everything else goes by the wayside. This is the single best way in a Marxist progression to get to a fully socialized democracy or a socialized government. Don't forget, ladies and gentlemen, we have a republic. This is a republic for a reason. We are not a democracy. If you think back to what Obama said Wednesday night, one of the things that really blew me away was he said, we're a democracy. We are not. We are a republic. In his dreams, he wants us to be a socialist democracy, and we're not going there.
Okay. Next question, please.
With the onset of the takeover from the government of health care that they're trying to cram down our throat, cap of trade, several other issues as they try to destroy the Constitution of the United States, is it time for Texas to start looking towards secession from the Union?
Well, we don't have to secede from the Union. We can take up the conditions under which the Republic of Texas came into the Union. Texas has the right to divide itself unilaterally, without anybody else's approval, into 5 separate states. We can send that many more senators to Washington. President Smith, bless his soul, once threatened to take West Texas out of Texas as a separate state and be West Texas. When the East Texans were grumbling about West Texas going so strongly Republican, they actually wanted to cut off the funding to the Health Sciences University here at Texas Tech. President Smith's response was, you do that and we'll secede from the rest of Texas. And he could do it.
Yeah. And there's a real debate on this, too, because the 10th Amendment clearly states that a lot of these issues are states' rights issues.